Okay. Hello, everyone. Welcome to this webinar of the LAC Platform. I am Diego Mora. I am really happy to be here today. The webinar is a briefing of the 43rd Global Fund Board meeting. And I wanna just literally introduce, on May 14 and 15 was the first virtual meeting of the board of the Global Fund to fight AIDS, tuberculosis, and malaria. During the two-day session, key issues were addressed to continue the response to all the three infections. The agenda included topics relevant to achievements during 2019, but also to the Global Fund's strategies post-2020. The board, concluding its meeting, agreed on the imperative to leave no one behind, stressing the critical role of communities in keeping people safe, especially when facing a new wave of challenges, recognizing the severe danger posed by COVID-19 to progress made against HIV, tuberculosis, and malaria. The board asserted a strong commitment to striving for equitable access to and protecting the most vulnerable. We are in the end of the session, we will have the opportunity to ask questions. Please raise your hand and keep your contribution short to more people can participate. But to learn more about the Global Fund meeting, we have two great guests. I want to introduce her. Carolyn Gomes, she is a medical doctor working in public and private medicine in Trinidad and Jamaica, served on the executive of the Pediatric Association of Jamaica. From 2002 to 2013, Dr. Gomes was executive director of Jamaicans for Justice, a non-profit citizens' rights action group which she helped found and led to become a nationally, regionally, and internationally recognized organization advocating against states' abuse of rights and strengthening legislative and other provisions for the protection of rights. Her work on human rights was recognized by the United Nations in 2008, and she was conferred with the Order of Jamaica in 2009. Between 2014 and 2018, she worked as executive director of Caribbean Vulnerable Communities Coalition. She is member of the Developing Country NGO Delegation to the Global Fund since 2017, and alternate board member since May 2019, has a distinguished record as a human rights advocate. In the other corner, Erika Castellanos is a trans woman from Belize who lives in the Netherlands. She studied social work at the University of Belize and has a diploma in health research from the University of Pittsburgh. Erika was diagnosed with HIV in 1995 and since then has been active in activism, using her life experience as a migrant, destitute as a person deprived of her freedom, drug user, sex servant, and living with HIV to connect with and serve the community. In 2010, she founded the first national network of people living with HIV in Belize, which still continues to provide service in the country. Later, Erika became a focal point for REDCA Plus and REDLA Plus, and eventually became part of the REDCA Plus advisory group. Erika served as a representative of the people living with HIV at the Belize CCM, where she worked hard to improve community participation in global fund processes in the country and the region. Currently, Erika is a program director for GATE, Global Action for Trans Equity, an organization that works with trans people of diverse gender and intersex with the objective of advancing their rights, depathologized identities, increases leadership, and promoting human rights. Erika joined the community delegation in 2015 and has served as an alternative from the community delegation to the 2018 Global Fund Board today. Additionally, Erika actively participates in boards of various donors and platforms such as the International AIDS Society. Welcome, it is a pleasure to have you with us today.
Thank you very much, Diego, and thank you to everybody who has joined us today for this webinar. We're happy to share with you. So I'm gonna start sharing the screen so you can see. I hope everybody can see now. So this is report on the 43rd board meeting. You know, as you mentioned, it's Carolyn from Developing Country NGO Delegations and myself from the Communities Delegation. So what we will cover today, we're gonna go on introduction of the delegation so you can know a little bit of our delegations and how we work and how we can help you. Some preliminary impressions around the online board meeting, and then community rights and gender, strategy development, and COVID-19 and the 3 diseases. So I'm gonna jump right into the first part is how the board works. In case you're not familiar with this, you know, the board has 20 seats, 20 voting seats in the delegation, and each 20 voting seats made up of each delegation. 10 of these are occupied by donors, and the other 10 is by the implementers or recipients of the Global Fund. So each delegation has one seat. It has a board member and an alternate board member, and can sit on the table and make decisions and speak on behalf of the entire delegation. The board can pass electronic decision when it's not on sessions, or beyond its powers to the 3 permanent committees. In this case, it's the Strategy Committee, the Audit and Finance Committee, and the Ethics and Governance. As mentioned, each delegation has a board and alternate member, and our role is to speak on behalf and bring the views of our delegation, of our constituency, to the table around the decision making. For the communities delegation, we represent people living with and affected by the 3 diseases. Our current board member is Maureen Morenga. She is from Kenya. Our constituency focal point is Ms. Bruna Martinez. And Bruna is from Brazil, residing in the Netherlands, and myself as the alternate board member. I'm originally from Belize, now residing in the Netherlands. From Developing Country NGO Delegation, that's the delegation that serves and represents NGOs based in countries in the Global South. So that will be Latin American, Caribbean mostly. So board member is Andrei Klepikov from Ukraine. The alternate board member we have with us today, Ms. Carolyn Gomes, and the constituency focal point is Ms. Leslie Odenthal. There are many ways we can support you. So our delegations bring the voices and issues of our constituency. We're able to escalate concerns and issues and discussions with the Secretariat and with the board. Any challenges that our constituencies are facing at the country, for example, country dialogues in funding applications in the CCMs, stockouts, etc. This is where we can play an active role to support you addressing these challenges. Currently, we are having weekly calls with the board and executive on COVID-19. So if you have any questions or concerns around these issues, or there's something going on in your countries around particularly COVID-19 related matters around the Global Fund, please let us know. And we also have committee seats and can raise your we can raise your issues there. From developing, Ms. Carolyn Gomes sits in the strategy committee as a member, and we have I forgot his name, Carolyn, from the EGC. Barry sits in the EGC. We have Maureen Morenga, who sits in the AFC, and currently we have Rico Gustav from Communities Delegation serving as chair of the SC. We have other members, for example, which we work with. For example, the Developed Country NGO Delegation. With a delegation we partner with frequently, and we work together, and they also have some members. So we had for the first time an online board meeting due to COVID. It's not a surprise, you know, protecting the health and integrity of our board members who was gonna participate. And it was a totally new experience. Of course, it had its pros and cons. One of the things that was a little bit on the negative side was the very limited richness in discussions. There was no possibility to have cross-constituency conversation and lobbying. It was a huge amount of added workload and amount of hours needed for preparation. So it was even more than when we meet in person. There were some people that still experienced technical issues. And of course, a lot of the conversation was dominated by COVID-19. On the other hand, on the good side, so we had interventions that were centered and not too long. People, you know, we had emphasis in a few topics, so that actually, you know, lent itself that we had a richness on those very small small amount of topics. The written comments were read and referred to during the meeting, and as I said, it helped having an emphasis in lower of number of topics. And now I'm gonna go with Carolyn.
It helps if you're on mute. Good morning, everyone, and thanks for joining our webinar. Sorry about that intrusion, but we will move forward, sharing the issues we want to share with you and still have space for questions. So thank you to Platform LAC for this. My job today is to talk to you about community rights and gender, and through that lens, the strategic objectives 3 of the Global Fund. And for those who are not clear, strategic objectives 3, one of the pillars on which the Global Fund builds its work, is the protection and promotion of human rights and gender equality. And it's a particular an issue dear to the hearts of the 3 delegations, the Developing Country NGOs and communities, because we understand the importance of that protection and promotion in enabling us to meet our targets and goals. Community Rights and Gender Division is a part of the Secretariat that is charged with operationalizing any work around community rights and gender, as it said. But part of the work of the delegations over the last few years has been encouraging the Global Fund Board to not have human rights and gender equality as a department, but to ensure that all the departments, all the various divisions of the Global Fund understand the importance of human rights as cross-cutting, as bedrock, as important to achieving any of the other strategic objectives of the board. For this board meeting, the Community Rights and Gender Department shared an update on its annual report, and there was also a management response. So the management looked at a report that was done by the Inspector General's Department on how they were operationalizing SO3, and they went through it and agreed to what they were going to. They in fact agreed to all the recommendations of the OIG to strengthen the work around human rights and gender equality, and they laid out exactly in what timeline they're going to be, exactly how they're going to do it and who will be doing it in order to strengthen that aspect of the work of the Global Fund. And then we were glad of it because it's something that the 3 C delegations, so communities developing and developed, had been working very hard to ensure that that work was strengthened. Next slide, please. So we responded by saying that this was a great update, but we needed to see more in-depth work done on it, and that we needed to have a deep dive at the strategic committee coming forward so that we can really drive forward the work of the Global Fund in human rights and gender equality. We also asked for some more technical information on how the CRG Accelerate, which is a program of the fund, is operationalized and resourced, because we want to make sure that all the pieces that go into having successful work on human rights and gender equality are not only on paper, but are fully resourced, fully operationalized, because our work across the years has told us that without human rights as that bedrock, without recognizing the human rights barriers that people face to accessing HIV, TB, and malaria care, then we're not going to be successful in promoting and protecting human rights and gender equality. We also pointed out that the CRG report lacked information on what actions will be pushed and taken beyond the Secretariat, including in-country work. So what are they going to do to strengthen the CCM level, the SR, PR, SSR level in doing the work that's required to do human rights and gender equality? And we pointed out that time frames are critical for implementation. If you don't have a time frame, as we all know from our work, if there's not a deadline, you're not. Perhaps we'll get to that tomorrow. So we asked for time frames and completion of the recommendations. Back forward again, Diego. Next slide. No, right, yeah. Next slide. The response about COVID affecting the ability of the Global Fund to provide timelines was not accepted. We are clear on what COVID-19 has done to all our lives, all our work, and the implications are huge. But we said that this is not acceptable. We have to have a plan, and we have to have a time-bound plan to make sure that we're actually doing this work effectively. And now I'm going to hand back to Erika to talk us through the strategy development, which is what is on a priority for the board now.
Okay, finally I was able to unmute myself. So for strategy development, which is like a big component and something we're working on and having a lot of emphasis in at the moment, what you can see in your screen is the road to 2030, you know, like a little timeline there, you know, the strategy consultation, it has now been launched. I will talk a little bit more on the next slide. It's gonna have TRP input. It will go to the partnership forums at the last quarter of this year, and then the strategy should be approved by the last quarter of 2021. So you can find in the website, actually, you can see the Global Funds website for the strategy development has been launched, and there's the website there. Diego will be able to share the slides with all the participants afterwards. So you have the opportunity to provide feedback on the strategy in this way. There's a series of questions that are being asked, and this first round of input received by September 1st will be reviewed by the strategy committee in its next meeting in October 2020. In the same website, you can find background information around the development, and more information that will be able to help you to participate in the consultation. It's available in several languages, although the survey itself for now is available only in French and English. And one of the things, the delegations have been really fighting, and particularly the Developing Country NGO Delegation, is around meaningful involvement of communities. We know that most likely the partnership forums will be held virtually, because one of the things we really want to uphold is the safety of participants. We don't want anybody to be put in danger just to travel to be in a partnership forum. So there must be ways to consult in a larger manner, in an expanded manner, with communities and civil society outside the online written feedback. So be sure to develop other inclusive participation strategies that will guarantee meaningful engagement of communities and civil society. And given the limitations of virtual engagements, even board members had issues connecting to the board meeting. So the delegations also recommended that it includes in-depth interviews with key stakeholders that can gather information, qualitative data, especially from communities and civil society, also having focus group discussions with partners and stakeholders. So it can actually look in many ways, telephone calls, WhatsApp groups. So we need to be creative, so that we ensure that communities are included. Particularly, not all communities have the same access to technology as some people. So that limitation, we need to address it in order to have meaningful engagement of everyone. And so one of the issues that the delegation brought forward was, that we cannot begin working on developing the next strategy until we have had a thorough review of the current strategy. So it's actually important to see, what have we achieved, what was missing, what went wrong, what can be done better. This process has not been done in full yet. And the technical review panel, the TRP, has a number of reviews, also the TURG and the OIG. So around strategic performance and reporting, and this can be used, synthesized in the kind of review in addition to the TURG and the SR 2020 review to be finalized in the fall of 2020. So all these issues can improve the review of the current strategy. What we're talking about on the content of the new strategy. So among all the delegations, not only the civil society delegations, but across the board, there was a consensus that the emphasis on the three diseases is still relevant, and the strategic objectives should remain. So the 4 pillars of the strategy are still relevant also, but with an emphasis on innovative ways that we can address the shortcomings of the previous strategy, strengthen the implementation of these strategies in the new contexts in which we find ourselves, particularly in the issues of human rights, on strategic objective 3, which is to protect and promote human rights and gender equality. And we cannot continue to fail in these objectives. So we need, this is an opportunity in this new strategy to be able to influence that. So yeah, you can participate, and we really encourage all of you to visit the website and answer and participate in the consultation, because all your voices are important. You know, you need to make sure your voice is counted and is taken into consideration in the new Global Fund strategy. And then back to Carolyn.
Thank you, Erika. Yeah, I think we're going back one slide, Diego.
This is it.
Yeah.
This
Right slide. Yeah.
It's Erika.
Just to give you an update on the COVID-19 and the 3 diseases. We all know what we're facing in this region with COVID-19, and not only in this region, across the world. It has disrupted all our lives. It has disrupted a number of our programs. It's disrupted outreach. It's caused a lot of challenges for people who are living with the 3 diseases. And we are very concerned about it. The disruptions in services, including the drugs, accessing drugs, visiting health providers. And we know that there's a lot of self-limitation. People don't want to go to the clinic because they're afraid of catching COVID. So they're not collecting the medications. And in fact, there have been a number of reports done by the partners of the Global Fund, like Roll Back Malaria, Stop TB, Stop AIDS, that have looked and estimated that the longer this continues is the more progress that will be lost. And there's some frightening estimates that if it continues, we will lose our progress on TB and be right back at around 2013. That HIV, we will lose about 3 years of progress. Rollback malaria, the number of deaths are expected to increase exponentially. And that includes, in particular in the case of malaria, access to the drugs, if they are also serving as drugs to treat COVID-19. So we're concerned that civil society and communities are on many occasions being excluded from the decision-making processes around what their governments need to do with that, are doing to deal with COVID without hurting the programs. And we're concerned about the lack of health services for populations. It's also particularly concerning for those who have harm reduction services, because quite often that's directly, like with TB, directly oversight of therapy, and people are not reluctant to give needles and syringes and doses of opioid substitutes to go away with. So we're really concerned that there are a number of challenges with how the COVID-19 is impacting our programs. Next. So at the board, we talked about the need. We pushed hard on the need for accountability for the additional funds that have been provided. As I hope most of you know, the Global Fund is provided an additional $1 billion of funding specifically targeted at COVID. 500 million as grant flexibilities, 500 million as a new program called C19RM that CCMs can apply for funds. But we recommended and pushed to make sure that the funds are made available to support community-led monitoring in country, and that the communities who should be involved in making the decisions are at the table, particularly for the C19RM grants, because those are supposed to come from the CCMs, and the CCMs should be making efforts to include everybody, even in the face of lockdowns. We expressed appreciation at the board table that the Office of the Inspector General had outlined a process to ensure accountability across the Global Fund's operations for COVID-19 funds. And we continue to work with the OIG as they prepare their program to monitor and measure and look at exactly what's happening with that additional money. And so we recommended an audit as well. Next slide. There was also a statement by the entire implementer group of the board, which constitutes 7 government constituencies and the 2 civil society and the communities delegation, which urged the board to consider the principles I'm going to talk to you about and actions in its discussions around responding to the challenges posed by COVID-19. And the principles are that the Global Fund should be leveraging the power of its multi-stakeholder engagement and partnerships at the national, regional, and global levels. So the CCMs are our partners. The RCMs, regional coordinating mechanisms, are the regional level, and global level, including their partnerships with WHO, et cetera. We said that one of the principles should be ensuring that the Global Fund COVID-19 mitigation and response strategies protect the populations rather than compete. And it needs to protect those most at risk of HIV, TB, and malaria, and ensuring that the programs that are in place from the Global Fund are actually delivered to them and not pushed aside by the requirements of COVID-19. Another principle is to ensure enhancing guidance so that people could be very clear what those funds were supposed to be used for, as well as in monitoring and risk management, and that the Global Fund needed to be the champion for quality, accountability, and oversight of all its work, including funds that are set aside. And while we appreciated the quick response and the flexibilities of the Global Fund, we said that the principles that underlie all our work should also apply to the work that the Global Fund is doing to support the COVID-19 responses in the country. Next. There is guidance on these funds, and it is still, the Global Fund has extended the window for the C19 RM grants to be put in place, because I know there was a slow response initially. People are just not able to meet, not able to even focus on this. So they have extended the window, which was May 30. It's now going forward. They haven't given a timeline, but as soon as possible is the guidance. But there is a guidance as to how CCMs and RCMs can apply for these additional funds. And the website is there. Diego will share after the meeting. But please bring yourself up to date, call your CCM, ensure that the work is going forward as it should, so that communities and programs can access these additional funds to ensure that we do not interrupt our programs just because of COVID-19. We also would like to invite you to share with us, the developing communities, directly to our websites, to our focal points, where there are instances where civil society and communities are not part of the in-country decision-making processes, or where key population services are not included in the COVID-19 response mechanism, or the funding requests, or the implementation activities. We want to make sure that you let us know if there are challenges that we need to raise at the board table, if there are improper actions, improper inclusion, lack of taking into account the views of those that the grants are meant to serve as these new funding requests are implemented. So talk to us, let us know, we can raise them. We can work at the Global Fund Secretariat level to point out problems. So we really look forward to hearing from you. Next slide, Erika. And how to contact us. On this slide, you'll find the focal point for the communities delegation and her board, her email, as well as the email for Erika. And for us, you can find the focal point, Leslie Odendahl, who is the Developing Country focal point, Developing Country NGO focal point, as well as the LAC member, and my email will be there as well. When Diego
I'm gonna put it now.
Okay. So feel free to feedback to us. Feel free to let us know what's happening, if there are any challenges, or to ask any questions. And thank you.
Am I putting the correct one, Carolyn?
Yes, that's the one that I read.
Okay.
For delegation work. Erika, I don't know if I have anything you want to add in closing.
No, not anything, but we look forward to hearing from you, and that will help us play our role better. So yeah, I'm looking forward if anybody has any questions.
Thank you. So thank you so much to Erika and Caroline for this presentation. Maybe the participants would want say something. Okay, Anwar.
Hi.
Hello.
Hear me?
Yes.
Yes.
Thank you very much, Caroline. Thank you very much, Erika, for that great presentation. I just want to say that the information that you presented today is very, very important for both for Latin America and the Caribbean. And I think the role of the LAC platform is to support you in this very, very important work to share it with the communities, all the things that you are discussing in the board. So what I would like to suggest is please let's coordinate with you, Caroline, Erika, and Jorge, in order to see how we can facilitate process of consultation or gathering information from the community. I think the work that you are doing needs the feedback and the orientation, and if the platform can play a role in this, please let us know. And thank you very much. I think all the information that you shared today is just very, very, very necessary to have for everyone. Thank you very much.
Thank you so much, Anwar. We look forward to taking up on that, because it's going to be very, very important that all means of communication are used to reach those who are hardest to reach, who have the least access to technology, but have important insights to share on everything, not only the strategy development process, but how COVID-19 is being, the COVID-19 grants from the Global Fund, and also the implementation and management of grants normally. And we're really grateful for the collaboration, and we really look forward to taking it forward. And as we go forward, we're developing as delegations a paper to present to the Global Fund Secretariat, which would outline a lot of the ways that we think that the consultation process should be enhanced. And we will ensure that the important role the LAC platform can play in this is foregrounded.
Yeah, thank you, Anwar. I think I agree with Caroline, and I think it will be really important, to have share more information and have communication. And I think the platform can play an important role, particularly around the consultations for the strategy development. I think that will be crucial.
Thank you, Erika and Caroline. Someone else?
Hi, good day. Hello.
Hello.
Hello,
Hi.
Martin. Who had it?
How are you, Martin?
Hi.
Good to see you. Hear from you.
I'm fine, thank you. Here, yes, thank you for the. Actually, I have to sit back and read it again and again, if it's possible to get this live presentation, so I can read it, because, as you know, the language is Dutch, and I have to understand clearly what's going on with what Global Fund is doing. From my understand is that recently Suriname had by CCM had proposed already a proposal for the Global Fund, but like 2 days before the deadline, we had a conference meeting, and And as Mrs. Gomez, you know, I work for an NGO for PLW, and I have other experiences like client must go to the doctor, have to get the medication, and I report that. But I don't see really a solution for it. And trust me, I myself have that own experience. I need my medication. But the problem is now that we have a total lockdown until the 21st of this month. And my last medication will be on the 18th. So I need to go on the street. But there is a system that is in play that it is only for I have to go on Monday. Like my name is begin by the C, it's only on Monday I have to be on the street. We have a total lockdown. I understand the situation. I'm scared. I'm afraid. I don't want to go nowhere. I don't go not even to the supermarket. I ask people to buy things for me. I don't go on the street because I know my situation. Even though my medication, again, I have a good contact, a relationship with my internist, my doctor, I have good contact like in the health sector. But still, I have that experience that there is no one available to help me to get my medication. Since I'm not living in Paramaribo, I'm living like 25, 24 kilometers out of Paramaribo. So I need a new prescription. My medication have to be collected at the pharmacy. And I hope I will get it before the 18th. So I have to rush and call everybody. That is me. But what about the rest who is not flexible enough to ask information, to look for information, to get all this thing in place? So it's the only thing what I can do. I can give support only online or through WhatsApp. And we are part of the Global Fund also. We're doing outreach activity. But our activity, what we do is like testing the key population and special MSM. We try to reach them and test them. But since the COVID situation, we have to stop this activity because we need a bigger space and all the kind of stuff. And as you know, in Suriname, we have like, yes, we don't have a law against homosexuality or wherever, but people are not really openly and say, yes, I'm MSM, I come to get tested. They need to private, they need to talk privately with you, and you have to win them and to give them the so that they can feel confident, so that they can get the testing. So since March, April, June, we don't do nothing. We couldn't do nothing. It's only we refer them to the center for testing, but they also close. So it is nice to get this info to get people who call you and say, by the way, I was tested last year positive and I need somebody to talk. Recently, I have someone in the hospital, but I couldn't visit this person. And this person need the counseling, they want to see me. It's not only on virtual, like we are on WhatsApp, and to understand, because this person was already on medication. She stopped, it's a transgender, she stopped with the medication because she was feeling well. Actually, when I asked again, why you stopped with the medication, she didn't get the information from the hospital. Wow. She didn't get the only message that she get was you have to get the medication on time every day. Don't miss a day. That's it. Is that counseling? I mean, I don't want to sell my healthcare providers from the clinic and thing. We are not in a competition, but please, let's work together. I think I'm working like more than 18 years for PLW, and I don't see things adjacent. When we start 10 years ago with the organization, it's like people are getting infected by the ages of 25 and 30. Now we see it's 16 and 17 years. And I'm like, oh my God, it's a child. And parents do not know about their sexual orientation. They don't know nothing about them, and they need somebody to talk with. okay, I mustn't lie. I have a good relationship with, since I'm working for the government, the Minister of Health. I have a good relationship with them, but I just report and report and report and report, but I don't see the
I can
solution in this.
hear I can hear your frustration, Martin, and I think it is probably a frustration shared by a number of people who work in this field. And it's just made worse by COVID. And it really is a challenge to do the work, to do it work effectively, to even, as you say, get medication. We're happy to hear about these things. We encourage you to, when you get the slides, please write to us and let us know so that we can bring these things forward. And we can even provide advice on particular issues as around the C19RM and how you might proceed, what is the guidance from the Global Fund around it. So thank you so much for being here. And I can only say hang tight. The lockdowns will end, but keep us informed so that we can see how we can provide solutions for you or what suggestions we can make and how we can take these concerns to the board. Lovely to see you, Martin. Thank you for your work.
You too, thank you, and look forward, yes.
Also, Martin, one of the things, because you talk about the services and the work you do as a community person, you know, on regards to, today we had a call actually with Petersons around personal protective equipment, PPE, and how this should reach actually the communities who are at the forefront, giving services, testing or whatever service the community is doing. So, you know, as Carolyn said, please do contact and you know, we would be able to advise on these issues.
Thank you. We had already from the government, we had like what we need for doing our work. We wrote them, but still we don't have, they still have to apply to Global Fund and ask them, is it possible to get the PPE? But remember, since the people know that they have to protect themselves, they need this hand sanitizer, they need the mask, and also there is stock out. And if you buy it, you must have money. And we have a problem like devaluation, and I can call it now, you know, things getting more expensive.
Yeah, and all of these are stuff that can be covered for community outreach under the C19RM grant. So it's important to talk with your CCM, make sure they've put in a proposal that includes these things for outreach workers, including all the sub-recipients, including your, you know, programs like the ones you deliver. Those need to be included, and the additional funding needs to support the work of doing your outreach during COVID-19, including protection, hand sanitizers, masks, gowns sometimes, depending on the work. Okay, so yeah, let us know, write us a formal letter, and let's give you a response. The guidance on the Global Fund Board actually sets out what to do. So you can look at that link and what can be included in those grants. So look at that link and make sure that whatever is possible for communities is included in that C19RM grant.
Yes, okay, thank you.
Thank you.
Yeah.
Thank you, Martin, for your participation. Anwar, you have the hand up.
Just, I just want to share with you that we will have a dialogue in the context of AIDS 2020 with Petersons on Monday, June 22. It is gonna be in the morning for our time. I think it's gonna be 6 a.m. in Belize, 7 a.m. in Kingston, 8 a.m. in Port-au-Prince, and 9 in the morning in Georgetown and Paramaribo. So this is a very important dialogue with Petersons in order that you can share also questions to him. So this is gonna be in a very, very relevant dialogue with him, because he will also approach these, the new strategy, the COVID-19 crisis, so many community issues. So if you can attend to this call on the 22nd of June, it's gonna be great. So just save the date, please.
Thank you, Anwar. We are coming to the end of the webinar. Maybe someone can add that else? No one?
If there are no questions right now, just feel free to get in contact with us at any moment, because we will respond and address your questions. So thank you very much. And Martin, heel bedankt voor je werk.
Okay, maybe Carolyn, something else you want to share with us?
No, I'm grateful to the LAC platform for allowing us these webinars, one of which was yesterday in Spanish, this one today in English for the Caribbean and the English speakers. Grateful for that. We are open. We look forward to doing this again after the next board meeting, but we are also happy to share in between. Delegation stands ready to receive any information or questions or concerns. And we really look forward to doing this again to keep people updated on the work that we do on behalf of the communities and civil society. So we need your support, your feedback, your information. Thank you.
Thank you so much. Okay, we are in the final. Thank you very much for joining us today. We hope to see you at our next webinar, and remember to follow us on our social media. You can find us as LAC Platform, sorry, it's in Spanish, Plataforma LAC, on Facebook and Twitter, and also visit our website, plataformalac.org. Thank you so much, Erika. Thank you, Carolyn, again. I hope to see you very soon.
Soon again. Thank you, Diego. Thank you.
Thank you for all the participants.
Bye, everybody.
Bye.
Yes.
Hi. Thank you so much for setting this up, Diego. We really appreciate it.
Thank you too.
I didn't know you were here, my darling.
I came late, but I am here.
Okay.
Yeah. Take care. Bye.
Bye.
Bye-bye.